Have you ever been to the store and noticed a child touching everything? Or been to the clinic and wondered why that mom can't get their child to sit still for a couple minutes? Studies show the most important factors to consider in treating attention deficit hyperactivity disorder, also known as ADHD, are the types of treatments and the side effects that come along with those treatments. The main points that I will cover today are: what is ADHD, the different types of treatments, and the side effects from some of these treatments. Some symptoms of ADHD may include difficulty paying attention, focusing on a task, problems finishing an assignment, losing and forgetting things, easily distracted, trouble paying attention to details, and feeling restless. Before choosing a treatment for ADHD for your child, a parent should consider many different types of treatments. Medication is the most commonly known treatment for ADHD. There are two different types of ADHD medications: stimulants and non-stimulants. Stimulants actually have a calming effect to children with ADHD. The medication is believed to increase dopamine levels in the brain. With a stronger message, the child may be able to better control his or her activities. Non-stimulants are used with younger children or when stimulants do not work for other children. Another treatment for ADHD is therapy. Some parents choose to try therapy in conjunction to medication. Behavior therapy can teach a child different ways and strategies to stay calm and focused. Therapists may also help manage stress, anger control, time management, and improve organizational skills. Some parents see an improvement in their child's behavior after changing his or her diet. Dr. Mary Ann Block said that the symptom is simply your body's way of letting you know that something is wrong. Children diagnosed with ADHD usually have a health problem that is going undiagnosed or untreated. The most commonly underlying cause of ADHD is a low blood sugar, allergies, learning disability, hyperthyroidism, and dietary factors. One way to treat ADHD is by adding vitamins and minerals. Limiting sugar intake might also affect the ADHD symptoms. In this chart by Dorian Gedaham, a doctor from Kaiser, Southern California Department of Research and Evaluation, tells us that you can see an increase of children diagnosed in the last 9 years. This study estimates the increase of rates the first time ADHD diagnosis. Researchers found that the increase of newly diagnosed ADHD cases rose 2.5% in 2001 to 3.1% in 2010, which is a relative increase of 24%. Black children, shown in the dark blue, show the greatest increase in ADHD, from 2.6% of all black children 2 to 5 years of age in 2001 to 4.1% in 2010, a relative increase of 70%. Rates among the Hispanic children, which is in the light blue, shows a 60% relative increase from 1.7% in 2001 to 2.5% in 2010. White children, shown in the yellow, shows a 30% relative increase from 4.7% in 2001 to 5.6% in 2010, while rates for the Asian Pacific Islander children, which is in the orange, remains unchanged over time. Dr. Gedaham does say that while the reason for increase in ADHD is still well unknown, contributing factors may include heightened awareness of ADHD among parents and physicians, which could have led to the increase of screening and treatments. While treating ADHD is very important, it is very important to watch for side effects of the medication. Stimulants and non-stimulants can run these possible side effects: jitteries, restlessness, a difficult time sleeping, loss of appetite, headaches, and upset stomach. The majority of these side effects are mild and temporary in nature. If you notice these side effects in your child, you should call your child's doctor immediately. They will work with you to help reduce the side effects or find a different medication that works best for your child. Studies show the most important factors to consider in treating ADHD are the types of treatment and the side effects the individual has to these treatments. The points we covered today are what symptoms to watch for when deciding if your child has ADHD, the different types of treatment options, and the side effects to these treatment options. So next time you are standing in a store and a parent struggles with their child, give them the benefit of the doubt. Maybe that child is undiagnosed with ADHD. Are there any questions?
How do I know which vitamins and minerals to add to my child's diet to help with ADHD?
Each child is different and should be treated differently. Dr. Marianne Black recommends a blood test for her patients to find out what vitamins and minerals they are deficient in. From that test, you will be able to work with your doctor or your local health store to find the right combination to work for your child.
What types of food items should a parent eliminate from their child's diet?
ADHD is not caused by a person's diet, but it is affected by the food you put in your body. Dr. Feingold says the elimination of certain food additives from your diet of hyperactive children can result in behavioral symptoms. Getting rid of sugar and chemicals from your body will help you and take a few days to see the result. Everybody's body reacts differently to food, and a trial process will find the cause of the symptoms.
How do I know if a stimulus or a non-stimulus is best for my child?
The only way is to talk to your doctor. There are age limits on using stimulants. A doctor from the Marshfield Clinic in Marshfield, Wisconsin does not recommend using a stimulant on a child under the age of 5. The reason being, brain development increases the most between age 2 and 5. Non-stimulants also have lower side effects. It works with different parts of your brain and does not affect weight loss like stimulants.